And now I want to introduce Dr. Rodlisha Sneed, who is one of our checkup partners. She has a dual appointment in the Department of Psychology and at the Institute of Gerontology here at Wayne State, and she's going to introduce our keynote speaker.
Good morning, everyone. I'm thrilled to be here today to introduce my friend and colleague, Dr. Kenyetta Dotson. Dr. Dotson is the Director of Community-Based Implementation and Engagement for the Charles Stewart Mott Department of Public Health at Michigan State University, based in Flint, Michigan. She's a lifelong resident of Flint, and she's deeply rooted as a community organizer, a veteran, and a woman of faith. She has over 30 years of community development experience advocating for youth and families, and she is the co-chair of the Community Advisory Board for the Flint Registry. She leads the Pediatric Public Health Youth Advisory Council, and she serves on many other nonprofit and community boards. Dr. Dotson completed her Master of Social Work degree at Michigan State and her doctoral degree in Black Church and African American Studies at Ashland University. And today she is going to talk to us about Rx Kids, which is an innovative cash payment program in Flint for new and expecting parents and families. Please welcome Dr. Kenyetta Dotson.
Thank you. Thank you, Rodlisha, for that warm welcome and introduction. Truly do appreciate it. And I appreciate being here with all of you. I have already gotten such a wealth of information through the breakout groups and also from the brief presentations that happened beforehand. I'm so looking forward to learning more. So thank you so much. So as I mentioned, as Rodlisha mentioned, I am here to speak about Rx Kids. This is an initiative that was developed by Dr. Mona Hanna-Attisha and Professor Luke Schaefer, along with a host of many other folks. This is definitely a team, village, perspective, and collaborative effort. So when we talk about community engagement, this Rx Kids program movement could not have happened without the help of community partners, local residents, mothers, just all types of people working together hand in hand. So before we go to the next slide, I just want to give you a brief overview. And if anybody wants to take a picture of the QR slide, you can do that at this time, just to give you a bit of context regarding the city of Flint. Some of you may already know and some of you may not, but the poverty level in the city for the state of Michigan for a single family is 14,000, like 14,500. And for a family of four, it ranges about $30,000. So I share that with you because I want to put into perspective what we're going through in Flint, being an underserved, under-resourced community and impoverished community where this Flint water crisis has taken place. The poverty rate within the city of Flint is 35%. 35% of people within the city of Flint, sorry, I was reading chats as I was speaking, within the city of Flint live in poverty. And if you add to that, 70% of the children who are connected to these families live in poverty. So that's quite significant. The median income, household income for the city of Flint is $35,000. Now remember, the poverty level for the state of Michigan for a family of four is $30,000, but the median household income in the city of Flint is $35,000. The 70% of children that are impacted by poverty, this is 5 times the United States average, according to the University of Michigan Center for Poverty Solutions. So I just wanted to give you a little bit of context as it relates to where we are in the city of Flint as we begin to have this conversation. So Rx Kids, if you can go to the next slide. Rx Kids is a program developed for moms, for mothers, and these mothers live within the city of Flint. And as I continue to go through the slides, I will show you how impactful finances are for mothers who are pregnant once they become pregnant. But according to the CDC data, Black women are 2 times more likely to die from pregnancy-related complications than that of our white counterparts, with most of the maternal deaths being preventable. Most of these are preventable. And I just wanted to mention that, and also that even the wealthiest Black woman is at high risk of maternal mortality as opposed to the least wealthy white woman. So we're still dealing with a number of disparities, a number of racial inequalities, because all of this goes right back to systemic racism. It plays a big part. Black birthing people are more likely to experience life-threatening conditions, things like blood clots, postpartum hemorrhaging. And some of these things could be easily fixed, but when you have little to no access to healthcare, when you don't have grocery stores in the neighborhood so that you can access food, all of these things become incredibly difficult. And so a lot of women, primarily Black women, are dying because they do not have these resources. Can you go to the next slide? I would also like to acknowledge some of our partners who made all of this possible. You saw it on the very first slide, is Michigan State University Pediatric Public Health Initiative, which is now the Charles Stewart Mott Department of Public Health. We're doing a huge renovation on our campus. Hopefully some of you will get a chance to come by and see it when it's completely done. One of the other significant partners who made this possible is Hurley Children's Hospital, Poverty Solutions of University of Michigan, Give Directly, and the Greater Flint Health Coalition. And I just want to mention and give a shout out to Give Directly. Give Directly is the very first and largest nonprofit that sends money, cash money, directly to those living in poverty. So that's the way we're able to pay our moms, give them these no strings attached cash allowances, is by the resource of Give Directly. So this slide just shows a little bit of what I'm going to talk about as we move forward. I'll give you a little bit of background, which I believe I've already done, show you a little bit of the design, talk about the evaluation, the funding, the eligibility and enrollment, and then maybe also how you can be a part of this process. So Rx Kids is the first ever citywide prescription program for pregnant moms and babies at this level. So we are so happy to be able to be the first. We're already working with a number of other cities to help them to implement this great program within their cities so that moms who are living in poverty can also receive no strings attached cash allowances. And when I say no strings attached cash allowances, the reason why I'm saying that is because at the very beginning of us organizing and putting everything together with Rx Kids, we heard from some of our community partners, community leaders, who wanted to know, well, how are we going to determine or dictate or mandate how moms are going to utilize these funds? And our response was, we're not going to do that. Moms are going to utilize the funds based on how they feel these funds need to be used, whether it's a back bill, whether it's taking their kids out for the movies or dinner because they're living paycheck to paycheck and they typically wouldn't have that type of money, or if it's putting money aside for a rainy day. We're trusting moms to do what they feel they need to do in order to strengthen and increase the health outcomes of their family. Okay, we can go to the next slide. We understand that by helping moms during pregnancy throughout the first year of a baby's life increases their health outcomes significantly. It increases it so much. It strengthens the baby, it strengthens mom, and it helps the family from a holistic standpoint. So this is why through this program, we decided to prescribe a prescription for health, hope, and opportunity. Health, hope, and opportunity. And we have decided to take away the Band-Aids. There are no more Band-Aids. There are no more quick fixes. We are going to the root of the problem. This is why we have partners across the state, local, state, and federal, and also local community residents who are involved in this process. We have Republicans and Democrats who are working together. That's a lot of how we received much of the funds that we've raised, because many people are working together. When you talk about community engagement, we have engaged just about everybody who we could engage to support families, moms, babies living in poverty. We are truly going to the root of the problem. Moms face relative to poverty and other systemic issues that perpetuates the stronghold and oftentimes generational cycle of poverty. Rx Kids is certainly a vehicle for equity and opportunity. Okay, we can go to the next slide. This is something I love to highlight my city as a wonderful city, a beautiful city, that residents are Flint strong, we're hard as a rock, and all of those types of things. But the hard fact is Flint is one of the poorest cities in the state, with 1 in every 2 children growing up in poverty. And again, as I mentioned, 35% of residents live in poverty, and 70% of the poverty rate within the city of Flint pertains to children. So I just wanted to show this just a little bit more so that you can understand where we stand and when this water crisis occurred, how devastating it was to the people within the city of Flint, and how we're still recovering from that even 10 years later. So thank you. We can go on to the next slide. Genesee County is deemed one of the most unhealthiest counties in Michigan. And again, I think that correlates right back to some of these social determinants of health, the root causes of those social determinants of health, not having access, not having proper support, not having adequate resources, and things of that nature. As you can see by this graph, near the birth of a child, the family income drops sharply. It drops sharply. Moms are struggling with the little bit that they have without being pregnant. And once they become pregnant and they have this new addition, oftentimes they're spending money that they simply do not have. So having the Rx Kids program in place to be able to provide this cash allowance to moms has truly been a blessing. Okay, we can go to the next slide. In the city of Flint, based on the data that we had, roughly 1,200 pregnancies occur within a year. So according to our data, we are almost at a saturation mark, which means that we've connected, touched, and or enrolled just about every pregnant mom that's pregnant within the city of Flint into the Rx Kids program. And that's something big. If we haven't enrolled them as of yet, our team is working really hard to find out where they are, connect with them, reach them so that they can take full advantage of this wonderful program. Next slide, please. As you can see by this picture, many of the pictures that you see, whether they're on posters, on other marketing materials, on handouts, these aren't stock pictures. These are real moms living real lives. So the pictures that you see here is one of our team meetings with mom consultants, mom partners. Mommies are parent partners, and they work as a valued part of the MSU team. And we're very proud to say that. At the very beginning of the water crisis, the voice of the people was shunned out. We didn't have a voice. We weren't listened to. And the registry, Michigan State University, we work really hard to have the residents at the table, whether they're our kiddos, whether they're parents, and or community partners. So these moms that you see here, they review surveys, questionnaires, applications, any other materials that we're going to send out to our mommy network. We want to make sure that it's easy to read, that if there's any changes that we need to make, that we can make those based on the voice of those who are participating in this effort. So we definitely wanted to be community engaged from that standpoint. Okay, could you go to the next slide, please? Okay, the next slide, it just reiterates that there is no income requirement at all. There's no strings attached. You don't have to do this in order to get that. This is true. This is a gift. It is not income. It's just a gift to try to help support moms and to pull individuals out of the grasp of poverty. There's going to be 5 cohorts. That's why we're working so very hard to raise as much money as we can. Right now, we're in our first cohort, but we hope to have 4 more. Thank you. We can go to the next slide. This shows the funding breakdown. So I mentioned there's going to be 5 cohorts. Right now, we're on our first cohort. $11 million a year goes, $11 million per year is collected overall. $9 million goes straight into those cash transfers, that those no strings attached cash allowances. $9 million goes straight there. $1 million goes for operations, $1 million for evaluation, and then $55 million is what we hope to achieve over the 5 cohorts. This is the largest cash transfer program in the country, and that's something to be proud of. To date, this says 41 million, but right now we're at 43 million. So right now we have $43 million. We need roughly 9 more million so that we can make sure that we have what we need for all 5 cohorts. If you know of funders, if you know of people who want to be a partner in this effort financially, please just send them to the website, flintrxkids.com. They can gain a host of information and also find our contact information to reach out to us. Next slide, please. Eligibility. Eligibility is very simple. It starts in 2024 for Flint babies that are born in 2024. You have to be a resident within the city of Flint. And I also want to share that the cash follows the baby. So if a baby is born and dad gets custody of the baby or grandma has custody of the baby, the cash follows the baby. It won't stay with the mom if somebody else is caring for that child. Thank you. Next slide. Okay, I just wanted to share this. When the expanded child tax credit occurred in 2021, we noticed that people were in a much better place. And then when it went away, people went right back to struggling. Some of the cash that families used during that expanded child tax credit time period was much of what parents are using the cash for now, to help with their house, to help with utilities, to put money aside for a rainy day, to help children with clothes and additional food and things of that nature. Living in the city of Flint, we have to, and I'm hoping most people are, we have to search for healthy foods in order to mitigate the lead that's living within our bodies. So that's not always the cheapest resort. Having to buy vegetables and things of that nature. And if there's no grocery store in your area, then you have to find a ride. You have to do other things in order to get to an adequate grocery store in order to get the foods that you need to combat the lead that's within our system. Next slide, please. Okay, the impact on pregnancy and infancy. Again, this is another one of our pregnant moms, and she works as a strong advocate at the table. We hope to promote child development and lifelong health access and success for babies, moms, and families. We want to reduce the maternal infant health disparities that exist, some of which I reported to you earlier today. And we also want to prevent child welfare involvement and decrease prenatal poverty. Okay, the next slide, please. This slide here shows that, as I stated, that the earlier, when babies are first born, that's when they struggle the most. So that's why the Rx Kids program is so important, and we want to make sure that we're supporting moms while they're pregnant and when they have their baby. The first year of babies' lives is so very important, and that's why we want to be involved in their life early on so that hopefully as time goes forward, their life can be even better. The next slide, please. Okay, one slide that I left out that I just want to share with you all is, as I mentioned, a number of moms have already enrolled in the program, and a significant amount of money have been allocated to these moms. But the majority of families who are receiving these funds make $10,000 or less $10,000 or less. I thought I put that slide in this, but I guess I didn't. So I just want to make sure that you all understand that. There's no eligibility requirement. However, many of the families make $10,000 or less. So I just wanted to share that with you all. All right, for this, if you want more information, again, you can scan the QR code. And this gives you information regarding our website. Follow us on social media, Instagram, Facebook, and you can also feel free to call. If you know of a mom that's pregnant, please have them to call, and they're having problems like with enrollment or anything like that, please have them call the customer service number, where they can get a little bit more help. Okay, can you go to the next slide, please? All right, so how can you help? Before I tell you about how you can help, if you go to the FlintRxKids.com website, it'll tell you exactly how many families we've helped up to date. So up to date, Rx Kids have impacted 522 families. 522 families have actually enrolled in the program. And remember, I told you roughly 1,200 kiddos are born on an annual basis. We have just about reached our saturation point. Not only have 522 families enrolled, but 475 are prenatal and 47 postnatal. 210 transition into a postnatal position. So we are doing really good by the numbers. I just wanted to share that with you all. And I also want to share that, again, if you go to the website, but maybe, no, you probably can't see this, so I won't even bother. Total cash prescribed at this point is $897,500. $897,500 as of April 1st have been granted to moms and babies, no strings attached, by way of a debit card or direct deposited to their bank. So just wanted to share that. I think that's a little bit of good news to share with you all. And when you go to the FlintRxKids.com website, you'll see on the page where it says $897,500, you'll see where most families are within the $0 to $10,000 cash bracket. And then the next one is $10,000 to $20,000. And the third is $20,000 to $30,000. But everything else is very insignificant. So I just wanted to share that with you. So how you can help, just share the word. Share the word. If you have materials, if you go to our Facebook page and you can grab information off of there or off of the website, please share with your network, share with your family, share with your church, share with your community, share with everyone. You can get a hold of me directly, and we have bags that we can give out. We can give you a host of brochures and posters to take to your organization to post up and to share the word. If anyone has questions, they can call the customer service number, or they can reach me directly, which I will put my information in the chat. The next slide. So these, I think the next 2 or 3 slides just show some of our other partners. This has truly been a community engaged process and effort. We have anyone from the Charles Stewart Mott, from a host of our partners, from MDHHS, the Children's Foundation, to, if you can go to the next slide, to some of our community-based organizations. These are our organizations that's entrenched directly in the community. They're considered trusted champions within the community, and they work very hard. It was so hard to rebuild trust after not after, but at the onset of the water crisis, and even now, as we continue 10 years later. So we continue to work on trust, but as you can see by our partnerships, trust is being rebuilt, and we're getting to a better place. Not there yet, but we're getting to a better place. The next slide, please. This is just an extension of more of our partners, and there's even more that we need to add. But we're not just sitting in a building just sitting inside isolated. We are out in the community, engaging with our community, working with our community, inviting them to the table and letting them know how important their voice truly is. Okay, the next slide, please. And that's my time. I just want to say thank you. Please connect with us, Facebook, Instagram. Go to the website. I'll put my direct contact information in the chat. Feel free to get a hold of me, and we want to be able to help as much as we can, how we can. Thank you.
Dr. Dotson, we have a few more minutes. Would you be open to taking questions if we have any?
Oh, yes, of course.
Okay, yeah, if anybody has any questions, feel free to put them in the chat or raise your hand and you can come off mute. Dr. Daly?
I'm just going to this is awesome. And what you're doing is so impactful, not only to the mom, but to the babies, to their siblings, to the family itself. So kudos to you, Kenyetta. I just want to say this is awesome. And I'm hoping that you will obtain all the funding that you need and you can expand this for years to come. This is what pregnant women and their families absolutely need. The mother is the one that populates the earth. Sorry, that's just how it is. And that foundation needs to be solidly grounded. So thank you.
Thank you.
We have a question in the chat from Dr. Zimmerman. How soon will you begin to have some outcome data to show the impact of the program?
I would say we're collecting information now. The moms recently reviewed a survey. We had a group of parent partners and moms also review another Rx Kids survey. So we're getting those surveys vetted by our community partners, our parent partners, our moms, and data is being collected now, and we will continue to do that. I would say give us at least 6 months, maybe. And we should have some good information we should be able to at least share out.
Thank you. Dr. Eldor.
Yes, thank you so much, Dr. Dawson, for the wonderful work you're doing. And I was wondering if there were any pushback from, funding point regarding giving cash to participants. Were there any reservation? And I know you made a great point regarding like what we think is important for the participant might be not what they think right now, what is important for them. So how did you navigate that?
Yes, we did have pushback, but we had to stay strong on our stance that this is money, cash that we wanted to allocate to the moms. We want moms to feel valued and empowered to make the decisions that they feel necessary for their family. We don't want to dictate how they should utilize this money for their family. So we just continue to echo that message, and hopefully people will pick up on that. And I'm certain that if I were a betting woman, which I don't gamble too much, not at all, but I would be willing to say that the data will show that moms are utilizing the money for the right reasons.
Great. And we have another question in the chat from Ann Elrington. When might we anticipate an extension to cover areas? She works in 48141 zip code that has similar maternal characteristics, limited community resources, and high infant mortality.
Yes, actually, we're already working with other cities. I would say we're working with about 4 other cities right now to duplicate this program and build off of the assets that's already within those areas. Because we don't want to just bring something to them and say, this is what you do, this is how you do it. But we want to bring to them what we've learned, how we're doing things here, and then build off of what they have going on within their particular areas.
We're just looking at the chat, and we see that Wilma is saying thank you for your work and understanding that main thing low income people need is money. So I think people really like that idea. Rhonda said we have to stop policing the people that are underserved and marginalized. They know how to spend money the correct way for their families. And I agree with that. Any other questions?
I think Carrie has her hand raised.
Yes. Sorry, I didn't see that on my screen. Go ahead, Carrie.
Thanks, Mahat. Thanks for the incredible presentation, Dr. Dotson. I loved hearing about this. You have an extraordinary challenge in terms of building or regaining trust. And I just wonder if you can talk to the researchers and our community of attendees about what's involved with that, because trust is central to the kind of work we're talking about today. So I just wonder if you could share some insight on that.
Okay, Carrie, I'm sorry, my computer went out just a little bit. I heard share insight and trust.
Yeah, just to talk about the extraordinary challenge you have there in Flint, in trying to rebuild and gain the trust in the community. And if you could just talk to our community of attendees about your, what do you think is most important in that work?
Okay, well, I'll start off with what's most important is involving the people. That's what's most important. So often people are left out. We have a group of people at the table, we have our boards, we have our committees, and they're made up of people who we think should be at the table, you know, because of their knowledge or their position or whatever it might be. But at every table, a resident should be there. At every table, a youth should be there, a young adult should be there. So incorporating the community voice, being truly community engaged in an authentic way is what's really important. Rebuilding trust was hard here. We had to do it one person at a time, one step at a time, and it could not be a microwave result. A lot of people wanted to come in and they wanted to talk to people and they just wanted it to happen really fast. No, when you come to the city of Flint, because of what we've endured, you have to be patient, you have to take your time, and you have to allow trust to build organically. And so that's really where we are. We found trusted people in community. Our registry team is comprised of primarily Flint people. And for the people who don't live in Flint, they have a strong Flint connection. So we wanted to make sure that people were able to truly understand the impact of what Flint residents have gone through when they're answering our phone lines, when they're talking to people. Doing all of this, all of these things were and have been very intentional because we want to make sure that people understand that they are somebody and they truly are a valued part of this process and this work.
Thank you so much. And in the last seconds, we have one more question. Are you collecting information about how the money is being spent? And word of wisdom for the moms and families?
Yes, and that would just come based off of the surveys. We would, you know, ask moms, what were some of the things you did with the funds you received? How helpful was the additional cash allowances that you that you and your family came in contact with? And those are some of what we would use as it relates to data.
Thank you so much, Dr. Dotson, for excellent presentation, wonderful work. We're so happy that you shared that with us today, and we learned a lot. So thank you so much.